Hi, my name is Dr. Ali Naderi. I'm one of the fellows at Case Western Reserve Metro Health Medical Center. Here with me is Dr. Wilson Tang, and we wanted to talk about genetics in heart failure. Hi, Dr. Tang.
Hi.
Thanks for giving us your time. Can you tell us about genetics, role of genetics in heart failure, please?
So we have learned over the last few decades that some cardiovascular disease are inherited. It runs in families we've known for some time. However, our diagnostic capabilities have been limited. Recently, with the advance of genomic technologies, we are able to sequence patients and their families quite effectively. There are various standard panels that we have learned over the years in several diseases, and we know, for example, sarcomeric mutations are very common in dilated as well as hypertrophic cardiomyopathies. So those with strong family history, as well as those who have, for example, early onset disease, we often offer them genetic counseling and testing in a reasonably standardized manner. I think a lot of people questions about whether this is something that is going to change practice. I would personally say that it really comes on a case-by-case basis, but many patients do recognize they have a strong family history, and the cascade testing concept, meaning the ability to identify those who are at risk and have closer monitoring, particularly with children of affected individuals, are quite important and very much underused at this point. A lot of insurance companies are already accepting this notion that this is actually important. And I think in the near future, very near future, there are already compounds specifically targeted to genotype positive, phenotype negative patients, where we are soon going to have true precision medicine approaches to actually identify and treat these individuals. Very much like nowadays that we recognize, early detection and prevention of hypercholesterolemia is an important role in preventing myocardial infarctions.
Are there currently any genetic testing that will change your management for individual patients? For example, in hypertrophic cardiomyopathy, role of genetic in deciding who needs an ICD, for example. What are those situations at current time?
Yeah. It is still kind of controversial, particularly with the ICD idea. I don't think genetics itself has surpassed like the standard clinical indicators, although there is some indication that there may be some preponderance with specific mutations. For example, troponin T mutations are very well known to have arrhythmogenic problems. I think the more important thing is some of the rare conditions, particularly those who are progressive. There are several incidents, for example, that the actual mutations ended up being a very pathogenic and also malignant disease. And so early and prompt referral and consideration for advanced therapy is much needed. I think it's actually very important for us to recognize that it is upon us as clinicians to actually understand how to best use these technologies rather than relying on somebody to actually just tell us. I think clearly, nowadays the disease manifestation and this association between how to best manage patients really relies on us as clinicians, as translational scientists in many ways, to better deliver care to our patients in this day and age. And I would not be surprised that in the near future, more and more access of these testing will be available. And so I would not be surprised that patients may come with genetic variants to our offices, and we will have to have the infrastructure and equipped with knowledge to be able to approach these conditions.
That's very exciting. We look forward to that. Thank you so much for your time. And please, for more videos, go to youtube.com/FITSontheGo.